Arthritis is a condition where the joints inflame. This particular condition can either affect one or multiple joints at the same time. There are many different types of arthritis, the most common being osteoarthritis and rheumatoid arthritis. It's a condition which is most commonly seen in people that are over 65 years old, but nevertheless, it can develop too in kids, teenagers, and young adults. This condition is most commonly seen in women rather than men and people that are overweight too. Symptoms may include stiffness, pain in the joints, redness in the skin around the joint, swelling, decrease in your range of motion, fatigue in case of rheumatoid arthritis, as well as loss of appetite.
So, what causes this condition? This condition can be caused by a different number of ways, but first of all, we'll talk about the cartilage tissue. The cartilage tissue is a tissue that protects the joint by absorbing the shock and pressure created when we move and put stress on the joint. A small reduction in the amount of cartilage tissue can lead to arthritis. Another cause of this condition is an infection injury to the joint, which accelerates the natural breakdown of the cartilage tissue. Rheumatoid arthritis is an autoimmune disorder, which is also another cause of this disease. This happens when the body's immune system attacks the tissue of the joint, affecting the synovium, which is a soft tissue that produces liquid or fluid to lubricate the joint and avoid friction. This type of arthritis can invade and destroy a joint and can also lead to the destruction of the bone and cartilage inside the joint. Physical therapy and arthritis. The goals of physical therapy and arthritis may include improving mobility and restoring the use of affected joints, strengthening the muscles around the affected joints, also maintaining fitness and the ability to perform daily activities. Physical therapy will also teach you the correct posture and body mechanics used in daily activities in order to relieve pain and to restore mobility. Physical therapy also will teach you the correct way to use assistive devices, and they can recommend different treatment options. For example, using braces and splints, or different types of therapy like hot or cold therapy and to relieve joint pain and stiffness. Lastly, physical therapy will also recommend a modification in your environment.
There's no cure for this disease, so the right treatment can only reduce the symptoms. Potential outcomes can be persistent joint inflammation, progressive and multiple joint destruction as the inflammation continues, decline at the mobility and function, pain and stiffness that fails to improve the treatment. But there are some ways to avoid these potential outcomes despite the progress of the disease, like having a healthy lifestyle that includes sports like walking, swimming, and cycling, and also having a healthy diet. You must quit smoking, drugs, and alcohol. And you can go to PT to restore your quality of life and making easier your daily activities.